Thanks again, everybody, for taking a few minutes this morning to kind of get an update on where things stand with our business practices as a result of our current findings in our public health emergency. So today's presentation is based on the governor's order that came out last Friday. There's a lot of legalese in this document. You're welcome to read it if you'd like. There's a link here on the slides that reflects the direct link to the actual executive order. There's a lot of legalese in here. I printed the first page and threw it on the slides. As you can see, if you wanted to go to the link, you can see that it's the same information and so forth. So again, most of the information in this presentation is a result of the directive orders from the governor as well as local health authorities. So as you're probably aware from following the news and wherever else you get your news related to what's happening in the world today, there's a new system that the state of Indiana is implementing in terms of identifying specific counties in a color coding mechanism to kind of reflect where the higher cases of COVID cases are being currently found. And so I don't need to go into great detail. I did put on the slides here what the color coding means and the maximum number of participants for gatherings in the different color coded counties. So this applies to just general life, not specifically to case management. Obviously, it relates to our jobs as well. But these results that the state has put out applies to any other gatherings that we're doing in terms of church events or family gatherings or other sorts of things where there's a grouping of people. The darker your county is, the closer to red that it is. And I know it doesn't show exactly red on here, it looks more brown, but the closer the red you are, the lower numbers of people you're supposed to be having in the gatherings that you are participating in. That the state map that has the color-coded counties is updated regularly, and by regularly, I'm pretty sure it's every single day. When I went to the site to build this presentation, I believe there was a header on there that said something about it's updated at noon every day. I don't know if they do it more frequently than that, but I think they at least try to do it at least once a day. So the map you see here right now at 10 o'clock on Friday morning, if you go click on the link tomorrow morning or Tuesday morning or whatever, the map is probably going to look different. So just be aware that the images here in the presentation are based on when I pulled the data to build the presentation. So again, part of the executive order from the governor is reminding the Hoosiers in the state of Indiana that it is mandatory that we are wearing face coverings when we're inside a business, public buildings, other sorts of indoor locations. We need to be making sure that we are covering our noses and mouths with whatever face covering that we're using. Any of the indoor public spaces where it's not possible to maintain 6 feet social distancing also has to have the face coverings. And I apologize, I think I just said indoor, but I meant to say outdoor. So any outdoor public spaces where you cannot maintain 6 feet social distancing, you still need to wear a face covering in those situations. If you're happening to be using any type of public transportation, such as Ubers or taxis or public transportation like a bus or those sorts of things, you need to be wearing face coverings inside those vehicles. So social distancing is also one of the things that's outlined in the governor's order. Most of the information on this screen is reiterated from the presentation that we had a couple of months ago, so I'm not going to go word by word through this slide. A lot of this is repeat information. So this is a new screen. One of the tools that has recently become available is an online app that folks can use. It's open to the general public. Folks can use to plug in information about a particular activity that they're going to be involved in, or they're thinking about being involved in, to kind of help them reflect what type of risk being involved in that activity might be. And so I pulled up the app and plugged in the information for a particular activity that I was anticipating being involved in. The particular activity that I chose for this example that you see my high risk category is showing on the screen, I had plugged in that I wanted to go grocery shopping, and I thought I was going to be in the grocery store for about 30 minutes, and I was going to be wearing my face covering, but I couldn't guarantee everybody else in the building was going to be wearing a face covering. And I thought there might be about 50 other people in the grocery store at the same time I was there. And so you can see that with the information that I plugged in, it's telling me that that particular activity of going to the grocery store falls within the moderately high risk category. And so I, as an individual, need to decide, is it appropriate for me to go grocery shopping? You know, am I comfortable with this level of risk? Well, if I really need milk, you know, either I can chance it and do my high risk activity, or I could perhaps consider doing some groceries to go kind of application. Depending on what grocery store you use, they call it different things, but basically you place an order online or call ahead or whatever and pick it up curbside. So there are options for folks to consider how to still navigate your life, but recognizing that there are risks involved in whatever activity that it is. So on this screen, there are some links that I have embedded here in the presentation, but I've also shared this information on the Teams app where we're sharing information about tools and resources and such for folks as they're thinking through, okay, we've started to enter the winter season. We're, you know, working with families and individuals that are thinking about having holiday celebrations or even our own personal holiday celebrations. What are some things that we need to be taking into consideration, knowing that there's other things going on in our lives or in the lives of people that we interact with that we just need to be cognizant of maybe planning a little bit differently this year. So I'm not going to click on all of these. These are going to be available in the slide presentation that will be available online immediately after this presentation. And like I said, they're on the Teams app as well. So here's just a reminder of what some of the signs and symptoms of COVID are. These are probably ingrained in everyone's brain right now, so I don't need to read through all of them. The important piece of this is if you're exhibiting symptoms and you feel like you're sick, please stay home. Stay home really does mean stay at home. Don't be taking your kids to the zoo, and don't be, you know, going out and, you know, going to the bars or whatever social events that you feel like, oh, but I need to get out of my house. If you're going to be exhibiting symptoms, if you're going to plan to stop the spread of the disease, you really do need to actually stay home. So when people are staying home, there's some confusion right now going on about, well, what's the difference between quarantining and isolation? Quarantining, according to the CDC, is what happens when the quarantine is what keeps someone who actually has been exposed to the virus away from other people. And isolation is keeps someone who is infected with the virus away from other people, even if it happens to be within their own home. So on the screen, you see some of what the CDC recommends about who should be quarantining. There's some definitions on here about the close contact and how that's defined by the CDC. You guys are welcome to read through this. I'm going to skim through a lot of our slides today because I just want to refresh people's memory on some of the information, and you can come back later if you really want more detailed information. A lot of what we're doing today is actually review. So if I get a negative test, what do I need to do? You've been exposed and you're exhibiting symptoms, so you still need to be making sure that you are social distancing from people, doing your quarantining, getting plenty of rest, drinking lots of fluids, washing your hands, all of the traditional kinds of things that you need to be following. What if I test positive? Well, again, you need to be separating yourself from other people. You're going to be following some of the same protocols in terms of getting rest, drinking fluids. You know, if you need to seek more help from your healthcare provider because your level of symptoms or respiratory distress is increasing, you need to be consulting your doctor or other healthcare professional to get further guidance on if there's additional treatments or things that you need to be doing. So when you're thinking about separating yourself from other people, there's a lot of questions right now about, well, how long do I need to do that? You know, if I'm exhibiting symptoms or not exhibiting symptoms, what does that look like? Is it 10 days? Is it 14 days? There's so many things that are kind of floating around out there about who's saying what and what the actual guidance is. According to the CDC, this information that we have on our screen right now is as of Wednesday of this week. It was what was on the CDC's website. So if you have COVID and you have symptoms, you need to be isolating yourself from other people for at least 10 days since the first times your symptoms appeared, and at least 24 hours with no fever, without taking any fever reducing medications, and your symptoms have to have improved. If you have COVID and you don't have any symptoms, you can break your isolation after 10 days have passed since your test. If you develop further symptoms after you test positive, make sure that you are following your symptoms or following the guidance here on the screen for I have COVID and I have symptoms. This slide breaks it down a little bit further in terms of the definitions between being exposed, testing positive, testing negative, testing positive and having symptoms, and testing positive and not having symptoms. So you see there some definitions for what it means to be exposed and what the action steps are for each of those categories. So this slide is kind of a review of what we've already covered. So if you wanted to see it all in one fell swoop, here it is. So what does this all mean to us as case managers and how we need to move forward with the ability to complete our job responsibilities? So it's critically important that everybody is maintaining very good communication with your immediate supervisor. It's important to stay on top of being honest and open about where things stand with your own health situation, as well as the health situations of the folks that you're responsible for. So if you may not necessarily be actively COVID positive, but you're taking care of a loved one who is, you're being exposed, and you need to not be interacting with people so that we're not spreading the virus. We are going to be returning as a company to the mindset that we had a few months ago in terms of most of our work is going to be able to be completed in a remote manner, like we always do with in terms of working from home and those sorts of things. We're going to renew our emphasis on having virtual meetings anytime where we've had situations where we need to traditionally do, you know, an environmental inspect and checklist or something like that, where we typically would go to somebody's house. We have the option to do that virtually still. And so that is something that the state is encouraging people to return to those kinds of ways of working. We just need to be super careful that we are documenting in our case notes to reflect that it's being completed in a virtual manner, as opposed to if you don't say that it's virtual, it's assumed that it's in person. And we can get in a lot of hot water if we're not being honest about the type of method in which we are conducting our work. I get it that there's a lot on our plates and there's a lot of things that are going on outside of work responsibilities that are weighing in on the amount of time that we have to get things accomplished. And so there may be some situations where you are maybe falling a little behind on some of the things that you would typically get done in a traditional amount of time. Maybe things are not getting accomplished as quickly as you want to, those are situations you need to bring to your supervisor's attention in terms of, hey, I've got this going on. I'm taking care of my grandfather who's COVID positive, and I'm also trying to do the e-learning with my kids, and I'm trying my best to get my case notes entered. You know, they're not going to be done by the 25th, but I promise they're going to be done by the 26th instead. Just be aware of that. Please just communicate that with your supervisor. There are some specific things, deadlines that have to be met in terms of getting case notes entered and those sorts of things, and making sure level of care is completed on time and budgets are submitted you know, before they expire and those sorts of things. But please just understand, we all understand that COVID is creating mass chaos now more than ever. And so all of us need to relax a bit and make sure that we're taking care of our own health, as well as making sure that we're providing the support that our loved ones need. And so please just communicate whatever's going on to your supervisor so there's not any misunderstandings or inappropriate conversations related to, well, she's not getting her work done. Well, if I would understand, or your supervisor would understand that, you know, what's going on in your life, just tell us and we understand. If there's some additional help that we or other team members can be stepping in to help do, we'd love to be able to help that. But if you don't tell us that you need that type of help, then we can't help with that. So please just keep those lines of communication open. I added a couple of things here on this slide to kind of just be reminders. If there is a need for translation for team meetings, I know that sometimes it's probably more efficient for the message to be conveyed when a translator is coming in person to do a meeting. And optimally, that really probably would be the best way to do translation for conversations. In this time of heightened health issues, we really need to be emphasizing the remote option for translators, not just to protect the individuals that we're supporting or ourselves, but those translators are often coming from a great distance away. There was a team meeting that happened earlier this week that I was aware of, where the translator drove 3 hours one way to get to the meeting. And so she's coming from, you know, an urban area where the risk of infection and so forth is significantly higher than some of the counties that we're working with. And so we're inviting germs to come when we're having these outside non-local people coming in. So can we please be respectful and ask for that remote option for the translation? Those of us that are still healthy and do not have, you know, maybe as many commitments or personal issues going on in terms of needing to provide support for several different loved ones or whatever, if we have the ability to step in and help cover situations, you know, enter data or do virtual meetings for somebody that is significantly ill or has a lot of support needs or different things, I would invite those of us who are able to kind of step in and help to please make that availability known to your supervisor. Unfortunately, this health pandemic that we find ourselves in is surprising a lot of people who are feeling like, oh, I'm healthy, I'm young, you know, I'll be fine, I'm not going to get it, you know, and even if I do, I'll be fine, it'll just be mild or whatever. That's not necessarily the case, and things are happening pretty quickly. And so if there were to be a time that someone wakes up one morning and says, oh my gosh, I have a full day of meetings and I just don't have the energy to get out of bed and I'm vomiting and whatever else is going on, we need to have some immediate people that we can reach out to step in immediately. And if we don't have a list of people to kind of tap on people's shoulders pretty immediately, then we're kind of setting ourselves up to fail in terms of providing the support that all of our staff need. So if that's something that you are able and willing to do, please make sure that you're talking with your immediate supervisor about your availability to do that. Another thing that I have here on this slide is just reminding people, go ahead and schedule your next meeting as if it were to be in person. So like for quarterly meetings, you know, I'd like to think that come March or February or whatever, we're going to get past this current stage of the crisis that we are in, and perhaps we'll be able to meet back in person. We need to be planning as if we were going to be meeting in person. But as we have been all along, we should also be reaching back out to the team a couple of days before the meeting just to check in, to kind of see, hey, how's everybody's health status doing? Is it still safe for us to proceed with an in-person meeting? Should we make adjustments in that plan based on what's going on with the team's health status or those sorts of things? So again, I'm not saying you have to meet in person. I'm saying schedule it that way, just so there's a date, time, and location on a calendar of when that next meeting is supposed to be. But you need to be revisiting that conversation. And if it's not appropriate to be meeting in person because of the health crisis, then it's perfectly fine to conduct that meeting remotely by Teams or FaceTime or whatever method the team has agreed upon as the best approach to do that. This slide is just a reminder. This is one that I had back on the presentation in May. Appendix K still exists where telemedicine has been approved. Currently, Appendix K does expire December 31st, but the state will continue to review the public health emergency and will likely renew Appendix K. I can't say that they will because that's not my call, but we've seen already that they have renewed it already once, and given the current status of where the health situation stands in the state of Indiana, there's no reason to believe that they won't consider renewing it again. The thing that we don't know is if it's going to look exactly the same as it currently does. You might remember when they renewed it back in August, there were some adjustments that were made from the previous version of the Appendix K. So just know that telemedicine will likely continue, but some of the other flexibilities that are in Appendix K might look slightly different. And so once the state makes that determination, they will release that information to us. This is another slide as a reminder in terms of we need to be still doing home visits, meetings, unannounced visits, and so forth, because they are required by our service definition for our case management service. But remember, those things can be done remotely by virtual tours, you know, FaceTimes for your home tours and those kinds of things. Just make sure that you are clearly documenting in your case notes how that event has occurred. When the individual or the guardian or family member is the one saying, we absolutely need to be doing it this way, please make sure you're documenting that it's their request to be having the meetings in those manners. This is a reminder slide as well. There are situations that are going to occur where we as case managers actually do have to go in person to meet with somebody. And so in the situations where we've received a sentinel event and somebody's being accused that, or has accused the family member of beating up their child or whatever, we need to go and physically place eyes on this situation and assess the situation to see, is this parent really beating their child senseless or locking them in the basement or whatever the accusations are. There are situations like that where we as a company are obligated to have that in-person meeting. And so in those situations, we as a company still are required to do that. But if the case manager who happens to be currently working with that individual that's part of the allegation is not able to do that in-person meeting because they are actively COVID or they're currently isolating or quarantining or whatever the situation is, We as a company still have to make sure that that in-person visit happens. It's just absolutely critical that the case manager is reaching out to their supervisor to say, hey, I got this Sentinel event, here's what's going on. I think it's really necessary we go and do this thing in person, but I can't go. That's where the supervisor needs to be tapping on the shoulder of those folks that have stepped up to say, I can go and help if it's needed. And so please just make sure you understand that the state is not saying, oh, it's fine to just work from home forever now, and you never have to leave your house. You don't ever have to go and visit with any of your individuals in person. That's not at all what the state is saying. So please, when you're getting Sentinel reports and the state bequests or whoever is saying, hey, case manager, please make sure you go make sure this person's safe, your response cannot be, well, the state told us that we should just be working remotely, and it's our company policy that we just work from home now. That's not the response that you should be giving. In the situations where we do need to go, we absolutely need to go. So in those situations where you absolutely need to be going, here is the health screening questions that were part of the original presentation. So I'm not going to read through them again, but just a reminder of the steps you need to be taking and the conversations you need to be having with the team members or whoever is going to be present in the location you're going to be at, just to make sure you're not walking into a situation that you're not prepared for. A reminder about PPE, our company does provide that for you guys. Everyone that was working with us at the time of the picnic, we provided a nice big box of things that was sometimes leaking the hand sanitizer out, but hopefully you got one that didn't. Anyway, we are open and willing to continue to provide those. You just need to reorder those items through the normal process that you use with any kinds of office supplies and such that you are needing. So the supplies at advocacy-links.com is the email address. Just shoot a note and say, hey, I need more hand sanitizer, or hey, I need some more disposable masks. Whatever it is you need, just let us know. We'll get it for you. A reminder about cleaning and disinfecting. We've talked before about if you're needing to have people sign things, with ink pens and such, maybe consider, using the wipes, the disinfectant wipes or whatever to wipe off ink pens as different people are touching them, or maybe consider using different ink pens, handing out an ink pen for each person to use. There's some other suggestions there on the screen, refraining from touching other people and other items that other people are using and those sorts of things. Reminders about personal hygiene. Please remember to be washing and disinfecting your hands. Again, this is review information for everybody, so I'm not going to read through everything on this slide. Here is the link for today's assessment for the presentation. I do need everybody to go take the assessment to make sure we have a document to present when we are asked by whoever's doing the auditing for the governor about whether or not we're communicating with our staff. This is the tool in which we're going to be doing that to present to show that we've had this conversation and shared our agency's plan. So please use the link. I would like everybody to do that quiz. I think there's 10 questions before the end of November. I will be posting this presentation online on the Teams app and such. And so if you want the link in that way, you can get to it that way, but I'm going to post it over here in the chat box. Oh, look, somebody already asked that question. Thanks for that. I'm going to post it here in the chat box. So those that want to click on it directly from there it is. All right. So that's the end of my presentation, but I am going to go over here to the chat box and answer whatever questions have come in. We are really doing good on time, so I don't want to belabor the morning. So if there's not a lot over here, then I don't want to waste everybody's time. So will this be a choice for the family, or do you want us to go remote? When will this go into place? what we've talked about today goes in place today. So I'm not exactly sure about the question if I'm answering that entirely. Is it a choice for the family? I'm not sure what's a choice for the family. They have to have team meetings, but they can choose if it's going to be by FaceTime or a Teams app or whatever. I think the team needs to be serious about, is it appropriate for us to be meeting in person right now? Most likely the answer to that is no, depending on the color of their county, I suppose, or other situations that team members have going on and so forth. So hopefully I answered that okay. So whereas we have been completing meetings in person unless the individual or guardian requested a virtual meeting, now we are returning to mostly virtual meeting and we just need to document the meeting was completed virtually. Yes, that is correct. Our intake meetings to take place in the home or virtually, just seeking clarification. Any meetings this information applies to. So whether it's an intake meeting, a quarterly meeting, an annual meeting, staff meetings, anything really applies to this. I mean, we talked earlier about the situation with the grocery shopping and how high risk that activity was. Anytime we're getting together, we're risking the situation of potentially passing along germs that nobody really wants. Okay, so there was a clarification about the choice part of that question. They were asking if it's okay for the family to choose to meet in person. Again, if a family member is insistent on meeting in person and the team feels like it's not appropriate, or the case manager themselves is in a position where they cannot meet personally, it's going to fall into that situation that we described earlier about if the family is demanding to have somebody meet them in person and the case manager cannot do it, then somebody from our company needs to do that. Maybe there needs to be a discussion about, can we reschedule the meeting? Does it have to be this time? What is it they're trying to accomplish by meeting in person versus virtually? Is there some compromise that can be made? Has there been any changes, to IRs regarding COVID positive clients? They are closing them immediately. I'm not aware of any recent changes to the IR process for COVID people. I think what the state is using a lot of that data from those incident reports for is more tracking, like how many consumers with disabilities or in group home versus waiver setting versus nursing home or whatever. I think they're using the data being collected through the incident reporting system to populate their numbers for the presentations that they're doing in terms of, hey, currently in the state of Indiana this week we have 432 of these and 6 of these and whatever. So I think they're getting close pretty quickly, primarily because all they're looking for is the number of people that are in the different services to gather that information for that report. Not that they're not concerned about people's health status. I'm not saying that, but I think the primary use of that information for the COVID ones is for that data collection purpose. I have a concern that some families that I am meeting with have not been wearing masks. I am afraid to offend them by saying, I really think you should wear a mask. Is it possible to have a statement that we can send to families requesting that when we come to the home that they wear a mask? Given the other information that we shared in this presentation about our company really kind of taking a stance and stepping back and promoting the use of remote team meetings, I wonder if that would be a better solution, so you're perhaps not accidentally offending them by insisting that they wear a mask. If they're open to having remote meetings, virtual meetings, FaceTime, Teams, whatever, Zoom, lots of people are using different formats, so I'm not sure what this family might be more inclined to use. I don't think it's offensive to request that somebody wear a mask. If you have to be in their presence, it's going to kind of boil down to how assertive or demanding or whatever the manner in which that you're making that request, and how comfortable you are with that. I mean, if they're going to be insistent, you know, you have to come to my house, again, we kind of go back to the question from earlier about, okay, if you actually truly demand to have somebody come to your house, you know, if the case manager themselves is in a compromised position and can't do that, is there another employee that has a little bit more comfort level or whatever to meet the request of the family that you're working with? But again, I would really encourage the family to really be considering the use of the virtual meetings. I wanted to clarify, are unannounced visits allowed to be done virtually if requested by the consumer or family? Well, unannounced visits, the purpose of the unannounced visit is to be a surprise. And so when you're setting up visits, it's difficult to do that in terms of, hey, next Tuesday, can you make sure somebody's available with their cell phone so we can do a virtual walkthrough or whatever. That doesn't really qualify as an unannounced visit. What I would say about the unannounced visits is that's one of those things that we need to kind of be a little bit more relaxed about. It's going to show up perhaps as being late on a report someplace, but it might be one of those things that we just kind of recognize, okay, we're going to get back into that and do that unannounced visit when the health crisis calms down a bit and you know, weather's better so that we can meet them outside or whatever the situation might be. If you want to move forward with doing an unannounced visit, I mean, no one's going to tell you you can't call and say, oh, hey, can you switch on your camera? But to me, that's a little bit awkward. If you're going to do that, then just make sure that you're putting in your case note documentation that you did it, but it was done in a virtual manner, so it's abundantly clear that the original intent of the unannounced visit isn't really being met in the way that it was originally designed. My IRs for COVID positive people are only staying open if they are in the hospital or really bad shape. Okay, thank you for sharing that. I am having the mask issue as well. They are either not wearing them, taking them off during the meeting, or not wearing them appropriately, such as only on the mouth. If a family requests in person, can we simply state that all team members need to wear a mask? Again, I think you can state that. I don't know how well you can enforce it because I don't want you to create a animosity or anything. You know, I don't want you to get beat up because somebody doesn't want to wear their mask over their nose. So I guess I would just again reiterate that, is it absolutely necessary that we meet in person? You know, can we not do this meeting in a virtual manner? I did one recently and a home was exposed to COVID. I had my mask and I stood in the foyer and my client came to talk to me. Is that appropriate? Yes. I'm wondering if she's referring to an unannounced visit. Yes. Oh, that was the next line. Yes. Yes, that's completely appropriate. Great questions, guys. Anything else you want to chime in with questions? I think I reached the end of those. I want to clarify that if we are tested and are negative and have not been exposed to someone who is positive, then do we need to quarantine for 14 days? Let me go back to the slide because I guess you didn't really say in there if you were exposed. I think the understanding is that the progression of events is that you are exposed, and then you would get a test to determine if you're negative or positive. And so if that's the sequence of events, you're exposed, and so you need to be following the steps to follow. So here at the top of this, we see that if you've been exposed, you need to stay at home and monitor your health. Stay home for 14 days after your last contact with a person who has had COVID. If you want to use the CDC resources, there were 4 different examples with calendars on them that showed like the different examples of situations where, you know, where you were in contact with various people at different stages of the disease and those sorts of things. So according to what the CDC is saying, your last contact with someone who has COVID is what your trigger, your time frame starts over with. So if last Friday you were in the presence of somebody who actively has COVID, and while you got tested on Monday and the test was negative, you still need to be quarantining yourself for that full 14 days. So today would be 7 days and next Friday would be 14 days. Hang on, there's questions coming in a couple different places here. If providers will not allow the case manager for unannounced visit, can this be done through FaceTime? I think we already answered that, so I apologize if my response is coming later. Yes, you can do it by FaceTime. It's not the optimal way to do that, obviously, and because it wouldn't be the true intent of the unannounced visit. And if you're going to do that, make sure you're abundantly clear in your case notes that the visit was done virtually by FaceTime rather than in person as the original intent is. Apparently there's a question on the quiz that seems to be misleading because it doesn't mention whether the person is exposed. I think the answer should be true because when I wrote the quiz, I again was going back to that logical sequence of it's anticipated that if you're being tested, most likely you were already exposed. So while the wording of the question doesn't really say was exposed and then tested, that is the assumption that that is the natural sequence of events. So please just answer that as true. So does this mean our staff meeting in December can be virtual? Yes, it can. Are there any other questions? I don't want to cut anyone off who happens to be writing something perhaps particularly long, but I also want to be respectful of people's time. I realize today's your office day and you were hoping to get some work done. Thank you very much for this information. It's very important. Just want to be safe. Yes, it is true. We want everybody to be safe. All right, guys. Well, thank you all for taking some unplanned time out of your day today to listen to our presentation. And thank you also for going and taking that assessment here before the 30th of November. I am going to close this out so you guys can get back to work. Have a great rest of the day, guys, and happy Thanksgiving.